Chandra Kavanagh, here at the Harlow Playhouse, there's a reception here. What brings you and your company to Harlow?
Very interesting question. So my name is Chandra Kavanagh and I'm the Director of Bounce Health Innovation. So Bounce is really an incubator, accelerator for companies in the field of medtech and biosciences. And we're visiting here from Newfoundland, Canada. And so what we've done is we've brought 6 of our partner companies, so that is 6 entrepreneurial startups in medtech and the biosciences, as well as 6 interns to look at opportunities for go-to-market in the UK. So we really think that because there are relevant similarities between the healthcare system in Canada and the healthcare system in the UK, that many of the innovations that are taking off in Canada might also have a role to play in improvements to the healthcare system here in the UK. So
where have you been so far?
Oh my goodness, I feel like we've been all over the place. We are based out of Harlow, which is really exciting for us. It's been an incredibly welcoming community. We've also been to Chelmsford. We've been working with Anglia Ruskin University, and we've spent some time in London with Digital Health London, Health Innovation South London, and we've also been working with the Canadian High Commission.
And what, at the end of the day, when you return to Canada, what do you hope to get out of this?
Great question. So each one of our partner companies has a different healthcare innovation, and each one of our partner companies has a different goal. So some of them are at quite an early stage where they might be looking for academic partners. They may want to run a clinical trial to try something with patients, whereas others are much further along and they're looking to sell into the NHS. They're looking to bring their improvement to the public and to the healthcare system here.
What you said about other similarities between healthcare in Canada and healthcare in the United Kingdom, what are those similarities?
So many similarities in terms of the structure, procurement models, the expectations when it comes to regulatory compliance, and also public versus private. So it's largely a public system, but it also has private aspects, very similar in Canada, quite different to our neighbor to the south in the US that has a largely privatized, almost completely privatized system. Selling to the US is quite a bit different than selling in Canada or selling in the UK.
And these are young entrepreneurs?
They are young entrepreneurs. We don't discriminate. We work with entrepreneurs of any age, but we are seeing a lot of very young entrepreneurs, people who work in the healthcare field, who are passionate about changing healthcare, seeing it improve. And you want to talk about young, you should see our interns. All of them are second or third year business students from Memorial University who are spending 4 months here in Harlow helping their companies make way into the UK healthcare system.
Is this a revolutionary scheme, a radical scheme, an innovatory scheme? How would you pitch it?
I would say that it is deeply, deeply innovative. That is what we're all about at Bounce Health Innovation. This is not a program that's run out of the Harlow campus before. It's very, very new, and we're passionate about bringing together the university, healthcare, private industry, and students to all benefit from one another. So I think this is highly revolutionary, and we're excited to be part of it. And this is just our first year, and we vision that this program will continue to run and continue to grow for decades to come.
Mike Wesolowski, what brings you here to Harlow?
Well, we're part of a very exciting program based out of Newfoundland, Canada. Memorial University and Bounce, a health tech accelerator, they've created a program which is bringing Canadian startup companies in the medtech ecosystem to the UK to explore bringing our technologies here and the opportunity to develop our businesses in the UK.
And tell me a little bit about your business. We were just talking earlier about radiology. Tell me a little bit more about that.
Absolutely. So radiology is facing a crisis. The demand for radiology services has completely outstripped the supply of available radiologists, leading to massive backlogs. In the UK, we have about 10,000 patients who are still waiting for imaging results. And so our technology addresses that backlog by giving radiologists better access to the tools that they need to do their work every day. So our company develops virtual reality software, and what we've developed is a tool for radiologists in virtual reality where they can now do their work anywhere in a virtual reality headset.
How will you know if this trip, this visit, has been a success or not?
Well, I think it's already been a success. We've connected to many people within the NHS and within the Harlow ecosystem. And we're already talking about pilots in England, so I think it's been a great success so far.
And what do you think of the campus? You've been to the campus, and
Yes.
this quite quirky. The idea of this
It
campus
is.
in Old Harlow. What we're here.
It is, but it's fantastic. I think it serves as an anchor for Canadian companies to come here in the future, and Canadian students to come here and help us grow in the UK.
Is this an exciting time for your business?
Absolutely. We're growing in North America, and the possibility of growing in Harlow actually is very exciting as well.